Hello, Rayni. It's very exciting to have you on the show today. To begin with, could you please give a brief intro on who you are and what you do in terms of your professional background and career path?
Yes. So I'm excited to be here as well. My name is Rayni Collins, and I am an online sleep therapist and dance movement therapist. I work with creatives and artists in North and South Carolina. I help them specifically with sleep and resting better so that they can make better work and enjoy their work even more. My journey to becoming a therapist started all the way back in 2010. Um, I actually, a few years prior to that, graduated with my undergraduate degree of a BFA in dance performance and choreography. After I graduated in 2008, I danced professionally for a few companies and worked a number of different jobs in order to pay the bills because being a dancer, being an artist, doesn't always pay the bills. So, as I was working hard, my health started to decline. And so I started working with an integrative health practitioner to try and just keep my body functioning, to keep going at that time. When one day we were talking and they were trying to help me figure out maybe a better career path option since I was overworking myself. So they brought up dance movement therapy to me. I had briefly heard about it in college, but after doing some research, I realized I was really drawn to it and it was intriguing and seemed to check a lot of boxes of interest for me and what I wanted to do. I found Antioch University, New England, and 15 days after getting my acceptance letter, I moved from Columbia, South Carolina to Antioch, to Keene, New Hampshire, to go to Antioch, New England, Antioch University, New England, excuse me. And in 2013 is when I graduated with my MA in dance movement therapy and counseling. And later in 2013, I got my first job as a therapist. And for 9 years after that, I worked at the outpatient facility with children to adults with various mental health issues. I was also able to go from a provisionally licensed counselor to a full licensed counselor, get my board certification as a dance movement therapist, and then also become a clinical supervisor helping other therapists in their work. So I'm extremely grateful for that whole experience because it led me to being able to open up my private practice in March of 2022, and and I've been in that ever since. So I opened Emotive Counseling, and so it's an online private practice that where I get to do what I do in working with creatives and artists across the Carolinas.
Wow, amazing. You've definitely had a very diverse and multi-stage, even non-linear journey towards becoming a dance and movement therapist. So there are many, many interesting topics I want to ask about. But to start off with the basics, could you briefly describe what dance and movement therapy is for those who are not familiar?
Yes. So, according to the American Dance Therapy Association, they describe dance movement therapy as the psychotherapeutic use of movement to promote emotional, cognitive, social, and physical integration of the individual. Or, in other words, it's using dance and movement as a means for change and for healing. Dance movement therapists are well trained in movement analysis and observation and using dance and movement as the intervention to help people meet objectives or goals that are set in treatment. Dance movement therapists are very well versed in meeting an individual where they're at emotionally and physically. So sometimes we have to consider their range of movement, and if we need to have a session from a seated position or from a standing position. And so safety is a huge priority when it comes to a dance movement therapy session, both emotionally and physically. A dance movement therapy session can look a lot like a dance class because there's the warm up phase of the session, both emotionally, mentally, and physically as well. Along with the middle part of the session is focusing on a theme or a set of skills that can either be done in movement and finding a sequence of either talking about talking about it or moving about it. And then at the end of the session is about a cool down, making sure that the session is coming to a close and that the person or people in the are in an okay state to transition back into their day. This can be done in a group setting or on an individual basis. There's dance movement therapists that are in hospitals, in schools, in outpatient facilities, or in private practice, like myself. There can be verbal processing throughout the session, or sometimes there's not much at all. But what really sets dance movement therapy apart from a regular dance class is that there's the exploration of the self or the inner world and discovering new ways to connect to the outer world, such as environment or people or situations or whatever it is that is causing them a significant challenge. It can be really rewarding for people when they have those light bulb moments of making realizations that they haven't been able to get to through just talking about it. So it's really, really cool to see that and witness that.
Right. And in terms of the verbal component that you mentioned, does it incorporate elements of CBT, which is cognitive behavioral therapy?
So it can, but not always. I guess it would really depend on the dance movement therapist that you would ask. Because just like other therapists, dance movement therapists have their preferences for modalities, their therapeutic modalities. So sometimes they do incorporate CBT or cognitive behavioral therapy, like myself. And I'm also trained in cognitive behavioral therapy for insomnia. A couple of other modalities that I specifically use along with my dance movement therapy skills is psychotherapeutic, or excuse me, psychodynamic and psychoanalytic, person centered therapy, and motivational interviewing. But if you were to ask another dance movement therapy, they may give you a different answer, naming other therapeutic modalities. So we're pretty eclectic in incorporating the different modalities along with our dance movement therapy skills.
Right, right. So it varies from therapist to therapist and it kind of adjusts to the client as well, like if they may need
Yes.
something more physical or something more verbal. You mentioned that you work online rather than in person, and that works great for talk therapy, of course. We have a lot of online CBT therapists, but
Mhm.
would you say it can be an obstacle for dance and movement therapy?
So, um, I think probably a lot of people would give the same answer of internet connection. So
Mm,
it can be especially be tricky when it comes to a dance movement therapy session is if there's a lag, then there's not a synchronicity in regards to the video. And if they're speaking or in any way, then there's the lack of really seeing them in time and what they're doing. But it still can be effective. And once, if there's not so much of the lag or the internet connection issues, it's still just as effective as long as the person meets in a safe place where they have enough room to be able to move safely. And they can, of course, do it either seated or standing. So again, still just as effective online as it is in person as
I think
well.
it's great news that even dance and movement therapy can be done online because for some people it can be a more accessible option or even the only accessible option, considering that some mental health conditions can make it very challenging to attend therapy in person, for example, due to social anxiety or lack of energy or body image. So we're grateful for dance and movement therapists like yourself who are willing to work online rather than in person. Um,
Mhm.
Before we move into discussing how different disorders are treated through dance and movement therapy, I wanted to ask about another interesting detail that I picked up on in your intro. You said that your private practice serves creatives and artists. Who falls under that category, and why do you focus on these clients?
How I describe creatives is anyone that makes something. So it's pretty general. Then how I would describe what makes someone an artist is making something with the intention to provoke thoughts and feelings. So the reason why I like working with creatives and artists is that I'm one myself and have always been one my whole life. Um, so I'm able to understand the roller coaster ride that it can be of the whole creative process from beginning to end. Um, and there's a different level of vulnerability I think it takes to be a creative and artist by putting work out there to the world to be viewed, as well as to be open to criticism, whether that's positive, negative, or anything in between. So the learning to deal with the internal criticism that comes within ourselves, and then dealing with the external criticism that comes from others are some big hurdles to jump. And so the whole process, the whole roller coaster ride of being a creative and artist, can be scary and daunting, but it also can be exciting and fulfilling. So what I really like doing in my work with creatives and artists is getting them to focus back on the joy of the work so that they can continue to do what they love.
Right. I can definitely see how the creative spheres are quite emotionally draining since you have to put a part of yourself out for the world to see
Mhm.
at all times. And it's definitely important to have a time to recharge, such as through dance and movement therapy, and to
Absolutely.
reconnect, like rebuild the personal boundary between what you put out and what you keep in. Um,
Yes. Yeah.
Moving on to the next interesting topic, what kinds of psychological problems or disorders have you treated through dance and movement therapy?
So that's a long list, it feels like to me, in the almost 10 years that I've been in practice. So I have had the joy of experience working with children, teens, adults with neurodevelopmental disorders, is a mouthful in itself, mood disorders, anxiety disorders, personality disorders, psychotic disorders, trauma related disorders, and substance abuse disorders. But what I've found is that I am most effective with and am most drawn to working with people with mood disorders, such as depression and bipolar disorder, anxiety disorders, ADHD or attention deficit hyperactivity disorders, trauma, and of course, insomnia and sleep is at the top of the list of what I like to help people with.
Great. So you definitely have experience with a wide array of disorders, and I would love to ask about every single one, but for the sake of time, I was specifically curious to ask about two that I think relate a lot to the physical body. So what is your experience with treating PTSD and eating disorders?
To be honest, I have more experience working with PTSD, post traumatic stress disorder, than I do eating disorders. Both really need specialized treatment, as do a lot of mental health issues. There are a lot of DMTs that have extensive training and experience in working with eating disorders, PTSD, and other mental health disorders, incorporating dance movement therapy and other modalities. Uh, in my experience in working with people over the years in the different age groups, what I've grown to notice is this shift that happens from childhood of being more visceral in the body and focusing on that experience and reacting from that place to then becoming more cerebral or mind based as an adult. And so, really reacting based on thoughts more than the body. And then the teen years are this weird, uncomfortable transitional phase that can be very confusing for a lot of people. when someone experiences trauma or develops an eating disorder at any stage of life, it seems to strongly influence that shift from the body to the mind. And in my work with people with PTSD, it's a gradual process to help them to just be able to sense their bodies as a safe space so that can be more open to the body sensations that are happening and become more comfortable with them. I usually do this a lot through dance and movement interventions, including teaching coping skills to help them to be able to regulate their nervous system. And early on, I do gradually address sleep disturbances and sleep issues and have to continue to focus on that through the course of treatment because it can be especially challenging for people who don't feel safe in their body because they usually do not feel safe about sleeping. So the key is to getting the person more relaxed and enough to be in their body, which can hopefully influence their mind to relax enough to get better quality sleep on a regular basis. Uh, that is when the real progress is made, is when people are sleeping better and feeling better in general.
Right. So it looks like you dedicate quite a lot of attention to sleep disturbance and insomnia. And I was wondering what made you want to focus on this specifically? Why is it an important area for you?
That is a personal question that I'm willing to to answer and open up about. It actually dates back to my childhood. I've had trouble sleeping myself for as long as I can remember. It actually worsened to a really scary point during my senior year of college. I actually got into a car accident because I fell asleep at the wheel one morning when going to my classes. At the time, I saw a sleep specialist who they wanted to assess me for narcolepsy, which I didn't turn out to have. What they did tell me is that my sleep clock was really, really off and that I was not sleeping very well and not sleeping according to my circadian rhythms. Looking back now, I don't think the doctor really, I don't know if they really addressed the high level of stress that I was trying to operate at and how much that was affecting both my quantity and quality of sleep. Um, I After that, I did adjust my sleep schedule a little bit, but not very much. I was young and having a lot of fun and not living the healthiest lifestyle. Fast forward a few years, once I started graduate school, my previous fast-paced life slowed down a little bit. And what I was learning in school was about the importance of basic needs like sleep. So I started to take a look at the changes that I needed to make myself, and it was a really hard adjustment in setting a sleep schedule and making sure I was doing a nightly routine that was helping me to wind down from the day, and then changing my mindset about sleep because I've had a negative mindset about sleep since it had been such a negative experience since childhood. When I started sleeping better on a regular basis, though, I it was as if it was really eye opening because I felt better because I was thinking more clearly. I was able to handle my emotions more appropriately, and my body was functioning better altogether. So I became very passionate about sleep, not only because of how it benefited me, but then I started to notice how other people were feeling better and benefiting from improving their sleep. So, what I've grown to know over the years is that healthy sleep is the key to health.
Thank you so much for sharing such a personal story. I can definitely see why you choose to focus so much on sleep now. And as I've discussed with other therapists who have come in on the show, sleep quality impacts all areas of function, from relationships to cognitive function to mental stability, anxiety, and a variety of others. So it's definitely important to tackle sleep at the foundation before you move on to tackling other things. Um, and I'm curious to ask, how can sleep disturbance be treated through dance and movement therapy specifically?
One way I explain this is that dance movement therapy is to help people move and dance for a better day to then be able to rest and sleep for a better tomorrow. Or in other words, dance movement therapy is to help people to externalize stress and tension to be able to get relaxed enough to then drift off to sleep. Dance movement therapy is, of course, one of my main tools in my toolbox in helping people in therapy. Another tool in my toolbox that I really like to use is Sleepbot. It's been a great add-on in treating people with insomnia because I get to see the data as the client puts it in every morning or throughout their day. And then I get to discuss that, whatever they put in at the next session. I've been able to see the numbers actually improve over time, as well as getting to hear my clients say how much they like using it and that they have been sleeping better. So those are just a few of my tools that I love to use in my work.
It's great to hear that Sleepbot has been useful to some of your clients. That's definitely the hope, that it can be a supplemental tool for regular therapy and for all different kinds of therapy. And I'm glad it's helpful to you as a therapist as well to track how your clients are doing. To start to slowly round off our conversation, I wanted to ask who you would recommend dance and movement therapy to.
That would be anyone and everyone. I believe that we're all dancers. If you look at the definition of dance or dancer, neither one of those mentioned skill level. It's simply a series and pattern bodily movements used to usually perform to music. So another way of looking at this is we all start out as babies, moving our bodies expressively before we learn and know how to speak. So to me, being a dancer is being human, and life itself is the dance.
Amazing. So anyone can get involved really, regardless of fitness level, regardless of dance experience. And it's all about reconnecting back to the bodily skills that you have from birth, really. I found it really
Hmm.
interesting when you mentioned earlier on that in the teenage years, we shift from bodily to more cerebral. And
Hmm.
dance and movement therapy helps you to reconnect back to that earlier stage of expressing yourself through the body
Yep,
and unlock some things that have stored up over the years.
exactly.
Um,
You get it.
Amazing. Um, if someone gets excited about dance and movement therapy after watching this, where would you direct them? What would be the next steps?
One great resource for someone to find out more about dance movement therapy, and if they're also interested in working with a dance movement therapist, they can go to the American Dance Therapy Association or ADTA website, which is www.adta.org.
Amazing, and I will insert that in. Great. I'm really hoping that we inspired some people to maybe try out this method of therapy and potentially it can help them with the issues they're currently experiencing, be it sleep or other mental health issues.
Mhm.
And Rayni, thank you so much for taking the time to talk to me today. It was an incredibly interesting conversation. Thank you so much.
I appreciate it, and it was a lot of fun. Thank you for having me.